Hey everyone, welcome back to 52 Weeks Older and Wiser. I'm glad to have you here today. Today I wanted to talk about medication management. As we get older, managing medications is essential for actually managing our health and our quality of life as well. Over 250,000 people are hospitalized for kind of adverse drug events every year. So I want this to be something that you don't just kind of let unravel around you as your medications and any supplements you might take kind of become more complex as you age. Today we'll talk about a little bit around kind of how that can happen, and then I'm going to link in the description below some tools to help you can take control of your medications and any other supplements that you might be taking. And it can also be a tool that you use for loved ones to help them kind of get control of what they're taking and kind of have a better understanding, and then share it also with their healthcare providers. So oftentimes as we age, we do develop more chronic health conditions. And sometimes what happens is that we are prescribed more medications to help manage those chronic health conditions. Just to add to the complexity, oftentimes we're seeing multiple healthcare providers. So we might have a primary care physician, and then we could have an endocrinologist and a cardiologist and an orthopedist, and we're seeing them all for specific conditions or issues. But unless you're in kind of a managed care setting, they're not all necessarily talking to each other. And so you are the person who needs to be able to communicate with each of those different healthcare providers what the other healthcare providers you have seen are telling you. And you also need to have a list of all the medications that they are giving to you, because all of the medications that you take are going into your body and they are mixing there. And you don't know, well, maybe you do, but a lot of people don't know kind of what happens chemically in your body when all those medications are kind of blended up in your system. I once was talking to someone who had an older adult mother who was in her late 80s, I think. And she walked into her bathroom one time and literally found a shoebox of different medications on her counter. And she talked to her mother about it and said, "Mom, what are all these medications?" And her mom couldn't tell her what they were all for. She just knew they had been prescribed to her at some point over the past several years, and she wasn't sure what they were for or when she should be taking them. So she kind of cherry picked at random which bottle she felt like or she needed to be taking the medication from. And it was just astounding to this woman that her mom was not managing these medications. But can you blame her? She is, seeing multiple doctors, and trying to keep it all straight in her head is just not something that any of us can do. She needed to have a system in place. And when you think about, if you think about all these medications, it's almost like thinking about your juggling, and every new medication or supplement that you're taking is adding another ball to your juggling. And then you think about some of the parameters or indications around those medications, so that you're supposed to take with food, or you're supposed to not take it with food, or you're supposed to take it lying down and you need to lie down for 30 minutes, or you're supposed to take it with a full glass of water. So you think about, okay, you're juggling all these medications or supplements, and then all of a sudden you add these, different parameters in there, and that just is like, okay, well, now you're juggling in the wind, or you're juggling underwater, and it's almost impossible for the average person to be able to keep on top of it. And so what happens? A lot of times the drugs can interact and cause different health issues, maybe gastrointestinal, tummy issues. Some medications are fine on their own, but then taken with other medications, they can cause a person to be kind of fuzzy and also have balance issues. So then all of a sudden you have falls as a potential risk when you're taking medications. And then you have people who perhaps can't or don't want to take the dosage that a doctor was given to them, and so they're splitting pills, or they're taking a pill every other day instead of every day. And then maybe they're deciding, oh, I feel better, I guess I don't need to take that medication anymore, and so they stop taking it. Or maybe they're unable to refill a prescription, and so they just don't get it filled, and they don't tell their doctor, or they don't tell their health manager or their family that they're doing that. And so these things can have profound impact on your life and on your health. So being on top of medications from the get-go, having a plan, having a written list of medications, what the medication is for, the dosage of the medication, who the medication was prescribed by and when, is so important. Having all those items in a list and then making copies of them and giving them to each and every healthcare provider. Another thing that might be important is actually giving the list to a pharmacist, because I have known some people who go to one pharmacy for one medication and another pharmacy for another because perhaps the price is better, and all of a sudden the pharmacies are prescribing things when their systems would typically send up a red flag. Oh, this person is on this heart medication and on this diabetes medication and this, anti-anxiety medication. But if a person is getting their medications from several different pharmacies, they're not going to know, and they're not going to send up that red flag. So being able to share that medication list with all of your healthcare team, pharmacists included, is going to make sure that that any of those, contraindications are caught right away and can be remedied. Because just because something is prescribed doesn't mean it can't change. This is essential, and it's an essential part of any age, but particularly as you're aging and perhaps dealing with more medical conditions. And I did want to note too that supplements is the same thing with supplements. Your healthcare provider needs to know what supplements you're taking, because some of those can impact how your medications work for you. So, kind of a serious topic today. I am going to link in the description some tools and resources to help you kind of gather all your medication information into one place and take control of this. It's an important part of health, an important part of aging. So thanks for joining me today, and I look forward to continuing this journey with you.